let's move into some questions about feeding. This one is from Anonymous. We are living in stressful times. How can stress impact feeding? Well, it's no secret that stress can affect many different aspects of our parenting, and feeding is no exception. We have to remember that stress can be healthy and normal. The goal for any parent is not no stress, because that would be impossible. Rather, we need to be focusing on developing individualized ways to manage our stress so that the impact of that emotion on our children is less. And that starts when our kids are babies. Now, we know babies can feel and react to mom stress. During the feeding process specifically, we want to try to create a feeding environment that supports a relaxing, calming, intimate endeavor. Whether breast or bottle feeding, this might include feeding in a quiet space, increasing physical touch, keeping mom and baby warm during feeding time. Some babies calm to familiar smells or music. Did you know that on the Pregnancy Plus app there are Disney lullabies? You could try one of those to help calm the room. Now, for breastfeeding moms, remaining calm during feeding helps with milk letdown and can promote breast milk supply. So doing your best to create a feeding environment for you and your baby will help support your choice to breastfeed. I think this is a good time to remind all of you the importance of self-care and mental check-ins with your partner during the postpartum period. Especially now, I want all of my moms to be honest and open if you're feeling significant mood changes that may be affecting your relationship with your new baby. Postpartum anxiety and postpartum depression are real things, and they can be successfully and safely managed. So reach out to your obstetrician or pediatrician and we can help. This next one is from Kay Jarring. How can I safely dry my Philips Avent bottles after sterilizing them with the Philips Avent 3-in-1 electric steam sterilizer? Sterilization is an extra layer of protection against germs. Daily sterilization of all bottles and parts is typically recommended for premature infants and infants with weakened immune systems. Specifically for the Philips Avent 3-in-1, this sterilizer uses natural steam to sterilize baby bottles and other products, killing 99.9% of harmful germs without using chemicals. The sterilizer will also keep its contents sterile for up to 24 hours if the lid is unopened, and it can sterilize all sorts of stuff like wide and narrow-necked bottles, baby products, and accessories, so it's a great tool to have. Now, after sterilizing, drying is easy. Just place the sterilized items on a clean, dry towel and put them in a place that is going to be away from dirt and dust. Then let them dry on their own. Don't introduce a towel or try to dry them by patting or rubbing. That can introduce bacteria back onto the items. But once they're dry, then you can just put the bottles back together and place them in a protected place like a kitchen cupboard or a protected shelf. Let's look at the next one. This one is from Miranda Burke. My baby gets frustrated during breastfeeding. He screams and suckles every 2 minutes. What does that mean? Well, this is a very common experience for many nursing moms. Even babies that are well-established feeders can have days that breastfeeding is challenging. If your baby is under 2 weeks of age and unable to sustain time at the breast without getting upset, it's time to talk to your pediatrician or lactation consultant. Don't be afraid to reach out. We don't want new babies going multiple days without productive feeds, especially in the first few weeks. But for well-established feeders, this change in behavior during nursing could be due to illness or reflux, a change in latch or breast milk supply, maybe misreading of a feeding cue, or just a bad day. It's okay if all nursing sessions are not exactly the same. But if your baby continues to show this type of behavior, check in with your doc and we can ask more questions to troubleshoot the problem. This one is from XOXO Haley Ray. Tips for weaning a 3-month-old from breast to bottle. This is a great question because this transition can be very stressful, especially if there's an upcoming deadline, like mom is going back to work or you need to start daycare. I like to think of the bottle as simply a tool to deliver milk to a baby, and so you have to choose your tool wisely. In this situation, transition from breast to bottle feeding, I want to choose a tool that mimics the shape and feel of the breast, like the Philips Avent natural bottle. This bottle in particular has a really wide breast-shaped nipple. It promotes a natural latch, very similar to the breast. And the natural bottle's nipple has flexibility. It allows natural tongue movement from the baby without nipple collapse. So once you choose your tool, try to mimic the feeding environment as much as you can, regardless if breast or bottle feeding. So that includes things we already mentioned: the quiet space, physical touch, similar hold and body position, warmth, similar sounds, similar smells. Try to feed baby also before she gets really hungry. If she's on a schedule, try to feed her 20 to 30 minutes before her next expected feed, so she will be a little bit more patient to work with the bottle. You might want to drip out a few drops of milk onto her lips to try and entice her latch. And then you have to relax. You gotta know your expectations. It's not likely she will finish the first bottle in its entirety, but a few coordinated sucks is gonna be a win. With patience and diligent practice, most babies will be able to learn to use the bottle over time. This next one is from Physiopedia Trujillo. What do you suggest to avoid confusion between the breast and bottle? The vast majority of babies can easily work with both the breast and bottle. If you want breastfeeding prioritized, then the majority of the feedings throughout the day should be from the breast. Offering a bottle once a day is not going to significantly change an infant's preference for the breast, so don't be scared to use the bottle as a helpful tool once breastfeeding is established. Katrina Solney asks, I have a breastfed baby. When do I introduce bottles? I recommend introducing bottles as soon as breastfeeding is established. Now, for most mom-baby pairs, this is somewhere between 2 to 4 weeks of age. The good news is you should have a wellness visit around 2 weeks of life with your pediatrician, so you can talk with him or her and ask for advice. At that visit, I like to confirm that a baby is back up to birth weight, has a good latch, is peeing and pooping well, and mom has confidence with her feeding plan. And if all of those things are a go, then it's time to start introducing that bottle. Like I said before, bottle feeding starts by choosing the proper tool for the job. In my office, I recommend bottle systems that support comfortable feeding for baby with very practical benefits for mom. So, because face it, this has to be easy. I look for things in a system that is flexible as baby grows, so you don't have to buy different bottles for every age. I like bottles with interchangeable parts and bottles that are easy to clean, because there is nothing more real than that. Now, I've already introduced the Philips Avent Natural bottle. This bottle system meets all my criteria with 4 different sizes and lots of different nipple flow rates, all interchangeable to keep up with baby's growth and development. There is also the Philips Avent Anti-Colic bottle. That also offers different nipple flow rates to keep up with your baby's growth, but it also has this cool technology on the inside. It keeps the nipple full of milk and not air in various feeding positions, and keeping air out of the nipple keeps air out of baby's tummy, which is good. The best part is you can get all of those benefits and feeding comfort, while the Philips Avent bottles have very few parts and they're very easy to clean, so that's a win-win. This next one. How do you keep up feeding milestones if you can't make it to your well visits? As a pediatrician, this is going to put me on my soapbox for a second, because I believe pediatric wellness visits are essential for a reason. Every child deserves routine care throughout their life, especially during the first 2 years of life. Getting to every well visit needs to be prioritized. Every pediatric office around the country has spent countless hours to be able to continue safe, effective care for our babies, so please call your doctor's office to see what they are doing. Feeding milestones are dependent on your child's growth and developmental progress and can be very unique from child to child, so be sure to ask for a feeding game plan from your doctor and what you can work on between the 2 visits, and make sure you schedule your next well visit when you're there. Brittany Ann 516. Oh, lots of questions about starting solids. When's the right time? When do I start? How do I start? What's the feeding schedule? Great. Talking about Talking about starting solid foods is one of my favorite conversations in the office because there are so many right answers here. Plus there's very cool new science that has changed our thoughts on food introduction. So as you are starting to think about first foods, I want to remind you that early feeding times are developmental experiences, not nutritional need. Babies need to be developmentally ready to receive the tastes and flavors of first foods in a very active and engaging way. That being said, I typically start talking about starting solid foods at the 6-month well-child check, because at that time, most babes are able to sit up on their own, they have more truncal support, they have a lessened gag reflex, and they're really showing interest in other people eating. Those are signs that a baby is ready to start with a few bites off of a spoon. Now, there's no right first food. Whether you do traditional pureed foods or baby-led weaning or anywhere in between, the goal is to have your baby touch and taste and play with a variety of foods while you create the environment around eating that is formative for a healthy relationship with food. Early introduction of high allergen foods like peanut protein, eggs, dairy, shellfish, gluten, sesame, they are recommended to be first foods to prevent food allergies. So be sure to talk to your doctor about this important new science. And as far as the schedule, trying foods just once or twice a day is enough at the beginning. We move to a more consistent 3-meal-a-day schedule closer to 9 months of age. Now, as you're discussing your feeding plan with your pediatrician, it's important to remember that early food experiences are for play and taste, not to replace milk nutrition. Babies should continue to nurse or bottle feed at the same volume during their transition to solids.